Rosacea is another common condition we see in dermatology, and it tends to develop sometime around the 30s and anywhere to the 50s. A common history that we get is a patient has a long history of having sensitive skin that is easily irritated by creams. And what the patient notices is they develop redness, and very early on it comes and goes. And there are certain triggers that the patient will notice that causes the redness. Each patient is unique in what trigger that they have. It can be anything from exposure to the sunlight, alcohol, spicy foods, or just a change in the temperature. You're outside in the warm, you walk into the cold air, you notice the flushing. And this flushing comes and goes for a period of time, but can become persistent. And at that point, it is distressing to the patient. And there are things that we can do in dermatology to help when that redness becomes persistent. But the most important thing early on is knowing what your triggers are and trying to avoid those. And once again, wearing sunscreen is very important for people with rosacea. Wearing a broad spectrum sunscreen and just incorporating it into their daily routine. Every morning after they wash their face, even if they're only going to be outside for 15 minutes, put on your sunscreen because that's protecting you and preventing you from triggering your rosacea. Some patients with rosacea will also go on to develop lesions that look like acne lesions, and they tend to develop on the face. And there are treatments that we have in dermatology to help patients with those, from creams to antibiotics. Another thing that patients don't realize is rosacea can actually involve the eyes. And this can go along with the redness or with the acne-like lesions, or it can be a completely separate symptom by itself. And it's typically a sensation as if patients have something in their eye and their eyes look very bloodshot. So that's an important thing to be aware of. And if you're having those symptoms, maybe seeing your local eye doctor.